Well, hello and welcome to the webinar. I'm Elizabeth Cherevaty. I'm a naturopathic doctor, acupuncturist. I'm a natural fertility expert, and I'm the creator of the Empowered Fertility Program. And I'm bringing you this webinar here today because I've worked with so many women and couples who have had obstacles on their path to pregnancy and have not had this pointed out to them from conventional medicine. And so those obstacles remained hidden until we were able to work together. And I found this to be really unfair. And so I want to bring to the forefront some of the common obstacles to pregnancy that you might be facing right now, and that you might even be aware of them, and some ways to overcome them, and also the top 3 hidden obstacles on your path to pregnancy that doctors aren't talking about that I really want you to be aware of, because these could be, the 1 or 2 things that are standing in the way of you bringing your healthy baby into the world. So let's jump in. And, you may be joining us today because you are facing fertility challenges and you would like some tools to help yourself overcome them. Or you may be trying to conceive and wondering why it's taking so long, and wondering whether there is, something blocking your path. Or you may be preparing for a pregnancy and you want to do that as healthfully as possible so that you can have the easiest time trying to conceive when you do choose to, and the best possible chances for having a healthy child. So welcome, and we're going to dive right in, and I want to give you amazing value today. And at the end of the webinar, I'll also give you an opportunity to have a conversation with me about the program and about what next steps might look like for you. And so we'll get into it, and I'll give you those details shortly. Sometimes when we're facing fertility concerns, it feels like there's an immense amount of pressure and an invisible biological clock, or maybe there's a lot of reminders from your friends or your family members or even your partner about we have to get doing this, and what's taking so long. And every cycle you may have a lot of despair, a lot of loss or grief feelings coming up, and this is really common, and I don't think it's talked about enough. When you're going through fertility challenges, it can be immensely stressful. And so today I want to show you why infertility is a problem, why it's a growing problem, and the 3 hidden causes of infertility that doctors just really aren't talking about right now. 7 ways to boost your fertility natural with daily choices that you can start making right away. And then how to reclaim your hope and your self-empowerment in this journey as you go forward and optimize your fertility and your health at the same time. So this is me, and this is me holding my niece, Eden. She's my eldest niece. And when she was born in 2012, something just happened to me. And I recognize that as somewhat of a turning point for me in my work with people who want to conceive and people who are pregnant and who are bringing babies into the world. And I just think this is such a precious population to be able to support. And I remember taking a course with one of my mentors, Dr. Dixon Tom, and he pointed out that the most important population to be working with to improve the health of the world is couples before they conceive. Because so much of your health today, both your and your partner's health, will actually predict the health potential of your future baby. So it's so exciting to be able to help you now, even before you conceive, and even while you want to conceive as soon as possible. That's great. And there's so much that we can do to really boost the health potential of your children and maybe even your grandchildren. It's really exciting. And so that's why I focus my practice on fertility, pregnancy, and pediatrics. And that's why I wanted to create a really empowering program, a journey for you that you can access from anywhere, including any country, because it'll be online, and to give you that information, that support, and that empowerment, and help you break through the obstacles on your path to bringing those healthy children into the world. So you probably know that in westernized countries, including Canada, where I am, 1 in 6 couples face infertility today. And that's become 3 times more prevalent in just one generation. So infertility rates have actually tripled in Canada. And it does affect men and women equally. You can see here from this graph that back in 1984, the infertility rate was only about 5% in the Canadian population. And it's going to be pretty similar for most other westernized countries. And in 2010, so that's 5 years ago now, 16% of couples had infertility. So you can see that that's a clear tripling of the rate in just about one generation. So I created this scale to help you find where you're at and where do you see yourself in this scale. So we have a fertility empowerment scale because, again, it comes back to how supported, how confident can you feel in your fertility journey? Do you know that you're making the choices that are most effective for you? Can you lean back and trust in that structure of your plan, or do you feel really at the mercy of your fertility clinic schedule? Do you feel like a number? Do you feel shuffled around? All of these experiences relate to your levels of stress in your fertility journey, and that can have a big impact on your well-being as well as your ability to conceive a healthy baby. So take a look through here and see, just note where you are feeling most aligned with as of right now, as of today. Okay. So when we look at these increasing statistics on infertility, we have to ask the question, why? I have this article, this little snapshot here from the British Medical Journal, and that article was published in 1992, and it was identifying that sperm counts had decreased by 50% in just 50 years. And that is an incredible drop and really concerning. And that's just one aspect of infertility that's changed and become a huge challenge for us today. So when we ask why, we often look for the cause. And, there's, like I said, about a third of infertility is being attributed to male factor, about a third to female factors, and 20% to the couple together, and about 10% of infertility is considered to be unexplained. Now, this is where natural medicine and lifestyle choices really shine. I've had many patients who have had quote-unquote unexplained infertility, and we've either been able to identify actual causes, so explaining the unexplained, and or we've been able to support their lifestyle, so their nutrition and their sleep and their subtle hormone balance and their well-being and detoxification, and we've been able to help them go on to have healthy pregnancies. So really fair questions, when you are facing infertility. You may be asking, why can't I get pregnant? Why did I have a miscarriage? How can I prevent a miscarriage from happening again? And even, is there something inherently wrong with me? So sometimes you feel like it's really something about you, and I want to reassure you, it's not an inherent flaw of yours, okay? So there's lots that we can do to uncover where the concerns are coming from. So if you have questions that you really want to see answered from today's webinar, or that you just haven't really let come into consciousness yet, Write them down right now. Jot them down on a piece of paper or on your iPad, and just declare what you really want to know about where you're at in your fertility journey right now. And if I haven't answered them by the end of today, then by all means send me an email. And my email is fertilityempowerment@gmail.com. I will read every email and I will answer your questions as best I can. Okay, so take a moment, just write those down. So when we're looking for the answers, why? Why do we face infertility? Why is infertility tripled since the 1980s? Well, we have some different societal changes that I'll go through. So we have a higher average age of marriage, and even of having, your first conception attempt. So we have now about 11% of firstborn children who are born to mothers who are over 35, and that's a huge increase from 3% in 1984. So again, about one generation, and that's a big change. And some of us also are in our second relationships or second marriages, and now we've gone through a lot of difficulty, a lot of pain, and rearrangement to be with that partner who really aligns with your life and your goals. And now it's really time to start trying to conceive, and that's great. But it can prove a challenge. And so the next category, of course, of fertility obstacles is stress. And at least a quarter of us say our lives are highly stressful, and about 3/4 of us total are under significant amounts of stress. Women tend to bear more of the brunt of fertility-related stress, and of course, we all have overscheduling. Many of us have urban lifestyles. There's more noise, there's more pollution, there's more family issues, there's illness. All of these issues are a big deal when it comes to our fertility, because it's sending our nervous system into a fight or flight state. And we kind of have two arms of the autonomic nervous system. One is fight or flight, and one is rest, digest, and procreate. So we want to be able to see where we can dial down some of the stress response so that we can dial up the procreation response, or the fertility aspect of our nervous system. Recreation and social poisons have also changed. So among young women between the early 90s and about 2010, there was an over 200% increase in the rate of heavy drinking. And heavy drinking in this study was defined as having 5 or more drinks on a given occasion at least once per month. And alcohol is a known deterrent to fertility, and so it's really concerning that it's on the rise, especially among women. There have also been increases in sexually transmitted infections, including chlamydia infections in women. Some of these infections go unnoticed for a long time, and that's part of the danger of them in terms of transmission, but also in terms of the amount of inflammation and potentially scar tissue that can be created in the reproductive system. So why the infections are on the rise, even though we tend to be a lot more aware about STIs and condom use, I don't think we know. But we do know that young women have among the highest increases in these infections. So chlamydia and gonorrhea being the top ones here for women. Our average body mass index, or our weight and height relationship, has also increased significantly from the early 80s until the 2000s. There's been an increase from an average of a BMI of 22.5, which represents a healthy weight, to an average of 29.5, which is overweight. And for a woman who's about 5'4", that would represent about a 17 pounds average increase in again, just one generation, and that's for women between 20 and 39. 12% of cases of infertility are attributed to the woman's weight, whether too high or too low. And today, more women are overweight than who are underweight. So this is a real concern. It also affects male fertility and contributes to oxidative stress, which definitely affect sperm quality. Autoimmunity is one that you may not have heard of yet. It is a type of illness created by your immune system. It's kind of an exaggerated response of the immune system, but it's directed toward some aspect of yourself. And 75% of people with autoimmune disorders are women, and a lot of autoimmune disorders appear around the childbearing years. Okay, it's actually the 10th leading cause of death in women who are under 65 years right now, and rates of autoimmune illness are growing. And these would include Crohn's, colitis, rheumatoid arthritis, celiac disease. There's a whole range, there's about 80 known autoimmune disorders, and these can have a role on your fertility. Medications can also be a hidden cause of fertility issues. Now, one example is there's been some recent research published on non-steroidal anti-inflammatory drugs. So these are drugs like naproxen, diclofenac. They're in the ibuprofen family. And recent research is actually looking at these drugs as a way to prevent conception without using hormones. So non-hormonal contraception, there have been animal studies looking at these drugs. And a recent study showed that women who had rheumatoid arthritis and were taking naproxen or diclofenac for their rheumatoid arthritis pain actually had delays in ovulation even after taking these medications for just 10 days. So that is something that's really new on the scene, and there are potentially hosts of other medications that can affect your fertility. These ones probably affect the prostaglandins, which are hormone-like substances that control inflammation in a micro environment, so in a micro level. And tiny little amounts of inflammation are necessary for fertility events like ovulation and implantation. So when you use a medication that systemically changes that, theoretically, that's the reason why it actually affected ovulation in that population of women. I also have malnutrition as a hidden cause of infertility because commonly we have a high calorie and low micronutrient diet, so low amounts of the vitamins and minerals and antioxidants that really optimize our fertility and our health, even though we may be getting enough calories and even though we may be following Canada's food guide or, the USDA food guide if you're in the US. There's also environmental contamination, and I literally mean contamination of our bodies. Even Inuit women who are living in Canada's far north in the Arctic have high, disturbingly high levels of PCBs and dioxins in their breast milk, even though those chemicals are not sprayed around the Arctic. And so it's a worldwide issue. Endocrine disrupting or hormone disrupting chemicals are almost universal, and they are found in a number of products that continue to be used commonly in commercial and consumer contexts, like plastics and even personal care products and cosmetics. So check out the EWG, the Environmental Working Group, ewg.org. This is a snapshot of an article that they have on their website. It's 12 hormone-altering chemicals and how to avoid them. It's a great start. And I'll touch today a little bit more on the 6 Ps to avoid. I'll get to that when we talk about greening our clean. But it's really important to support your body, your nutrition, your organs of elimination, because you can theoretically actually remove any of these toxins from your body. It just takes time and it takes the right support. So your organs of elimination have to be in healthy working order to eliminate these toxins. And a goal here is, of course, to eliminate them from your body before you conceive so that you are less likely to be passing on the effects to your children. So now let's move into hidden causes of infertility. So these are the ones that are quite strong causes of infertility that I've seen in my practice, which doctors, for the most part, are just not talking about right now. I want you to know about them. So immune infertility. Now this is something, it's related to the autoimmunity that I mentioned before. And the leader in immune infertility research is a physician by the name of Dr. Alan Beer, and his office is in the United States. And he has a book called Is Your Body Baby Friendly? So you can look that up if you think that your infertility issues might fall into this category. Immune infertility is where your immune system is actually creating an attack against some aspect of your fertility, such as your embryo or your partner's sperm. And again, this is not something that most doctors even think about, let alone talk to you about. There are 5 categories of immune infertility that Dr. Beer has discovered and treated. And where it can come from, it can be that the couple's genetics for certain genes are actually very similar to each other. And what that means is the embryo's genes are very similar now to the mother's. And so her immune system may not recognize the embryo as something different and to calm down the immune system around the embryo. Instead, her immune system recognizes it as an altered form of herself and so creates an attack against it. There can also be antibodies to neurotransmitters, sperm, hormone receptors, as well. Certain types of immune cells may be overactive in the woman's body and start to create too much of an immune response that affects the health of her embryos or your embryos. The second hidden cause of infertility is subclinical hypothyroidism. So you see I've created this graphic here showing a TSH, thyroid stimulating hormone, of 3.6. Now in a lot of cases, your physician will think that that's okay and let you keep going. But in the literature, endocrinology authorities worldwide agree that your TSH level really needs to be less than 3, ideally less than 2.5, in order to rule out a thyroid issue, so an underfunctioning thyroid, as being a cause of your infertility. Subclinical hypothyroidism is very common, and Hashimoto's thyroiditis, as I've listed here, is actually an autoimmune disorder. And even if you have been diagnosed with hypothyroidism, your doctor may not have tested you for the antibodies toward your thyroid, which tell you the cause of your hypothyroidism. So it tells you if you should actually be treating your immune system or just boosting your thyroid. It's really important to make that distinction. In population surveys that have been done, 6.5 to 8.7% of women have been identified to have subclinical hypothyroidism. And a majority of those cases are autoimmune, so they're Hashimoto's thyroiditis. And among women who have infertility, about 30% of them have been shown to have anti-thyroid antibodies. So this is something to make sure you've checked if you're having fertility issues. So you can ask your doctor for an anti-thyroid antibody blood test. It's a really simple blood test. So I have a couple of case studies to share with you from my practice. And none of the names are their real names. So this is Dana, and she started working with me when she is 40. And she has a teenager at home, and she has married her love of her life, her second husband, and he is 38 and he's healthy. And so they've been trying to conceive for 9 months before we started working together, and they have suffered 2 miscarriages and possibly a third very early miscarriage. Her nurse suggested that she had a thin lining in her uterus, and she knows already that she has Hashimoto's. And we identified as well that she had low iron stores, and I'll talk a little bit more later in the webinar about iron. So Dana discontinued her thyroid medication. She had been given Synthroid to boost her thyroid status, but she suffered intolerable side effects with that. So she took herself off that medication within about a week, and we initiated natural thyroid support. We also started with arginine, which is an amino acid that naturally helps to build up blood flow and blood vessels. So that helped to build up her lining. We helped her with an absorbable iron supplement and made sure that she was walking frequently and started acupuncture every week. In the second month, she hadn't conceived yet, and we added coenzyme Q10 and inositol to support follicle quality, and 2 herbal medicines, Vitex and Withania, to support her hormonal balance, specifically progesterone and her thyroid, respectively. She became pregnant after 2 months of an active natural treatment, and she had a healthy pregnancy, and her baby girl was born just last month, and both are doing really well. Okay, so let's move on to the third hidden cause of infertility. And this is hidden hormonal imbalances. So a lot of times hormonal imbalances don't appear on your blood work. And sometimes when they do, they're not being interpreted in a way that can help you actually overcome this as a hidden cause of your fertility challenges. I worked with a woman who was 28 when she came in to see me. She had never conceived, and she and her husband had been trying to conceive for 1 year. They had tried IUI and they didn't enjoy the process at all, so they wanted to just take a break from anything medical and focus on health and natural treatment. And so she also had high levels of stress and anxiety related to her work. And through noticing her cervical mucus, she noted that her ovulation was probably late in her cycle, around cycle day 19, whereas in a conventional or normal, let's say, 28-day cycle, you might notice your cervical mucus being more fertile at around day 14. It's not always the case, and I'll give you a little bit more information about charting shortly within this webinar. So she also took Vitex to support some progesterone, and she was to continue monitoring her cervical mucus. We optimized her diet, specifically increased vitamin C rich foods, fruits and vegetables. We started acupuncture every week, and that was to help with the stress and the Chinese medicine picture of liver qi stagnation. And she conceived after 1 cycle of active treatment. She had a healthy pregnancy, she has a really healthy child, and her baby has now just passed her first birthday. Another hidden hormonal issue is PCOS, polycystic ovary syndrome. Now, this is something that your doctors may have helped you to look for, but they may not have. It's estimated that 70% of cases of PCOS are undiagnosed. It is the most common female hormone disorder, and about 12 to 20% of women have it. And you may be surprised that it's that common, given that a lot of people still haven't heard about it. And women with PCOS have difficulty conceiving, often because they don't ovulate regularly. And they have a triple rate of miscarriage in the first trimester. So it's a really big deal when it comes to fertility. There are also increased long-term health risks of having polycystic ovary syndrome, and these are not to be ignored. And so this is really important to your overall health as a woman. Bone density, endometrial cancer risk, type 2 diabetes, and cardiovascular disease risk are all known issues, risk factors for when you have PCOS. And PCOS is really to do with having high levels of androgens, which are male hormones like testosterone. Okay, so it's normal for women to have some testosterone, but we shouldn't have too much. And when we have too much, we can have a lack of ovulation. We might have hair loss. We might have hair growth on the face. We might have acne. And women with PCOS may or may not have polycystic ovaries, so kind of multiple follicles that create cysts in her ovaries. Insulin resistance and metabolic syndrome are also commonly found in women with PCOS, and if we can start to address those factors, it can actually help to restore ovulation quite well. And as long as you know when you're ovulating, again, you can time intercourse accordingly, and you should be able to go on to conceive and have a healthy pregnancy. So my third and final case that I'll present today, this is Melissa. She was 28 when she came to see me, and she had polycystic ovary syndrome. She also knew that she had hypothyroidism, and she did not have Hashimoto's, which we found out. She was using donor sperm and her partner's eggs. Okay, so she's in a same-sex marriage, and they decided to use her partner's eggs for the IVF. She had conceived 3 times already with an IVF cycle, with 3 IVF cycles, and had 3 miscarriages. So she's been under a lot of grief and stress with this journey so far. So Melissa, we decided to do weekly acupuncture. She took inositol to help restore healthy follicles and ovulation. It's been shown in research to be as effective as metformin in women with PCOS. So in the end, she no longer needed metformin, and her doctors were happy to, recommend that she withdraw that drug. And she felt a lot better because the metformin was not making her feel very well. And then she did re-implement some exercise, and that was a great stress reduction for her. And she told me that she was in the best shape of her life going into the cycle where she ended up conceiving again, and she is now having a healthy pregnancy. She's about 22 weeks in, and her baby is due in February. So I want to kind of paint a picture of the hopefulness and the empowerment that you really can experience when you are trying to conceive. So what can we do? I love the word empower. I love the meaning of it. Empower means to give someone the authority or power to do something, or to make someone stronger and more confident, especially in controlling their life and claiming their rights. Now, I believe that you have a right to optimal health and a right to optimal fertility. We have been inundated with a number of factors against our will or without our consent, including the amount of contamination and pollution that's in our world, and including the way that our food supply has been altered by pesticides and different farming practices, and from getting away from natural ways of eating. And I love the synonyms here: to emancipate, unshackle, set free, and liberate. And so when we think about your fertility journey, I want you to know that it's possible to empower yourself even as you're going through something as challenging as fertility challenges. So I want to put some tools in your hands right now. So this is where we get to talk about the 7 key lifestyle choices that can optimize your fertility. And these are things you can do yourself starting right away this week as soon as you've done this webinar. So let's get into it. Number one is chart smart. Now you can see here, this is a chart that I use in my practice that I've designed to capture the necessary information about your cycle to inform you about when your fertile window is and whether it's happening at all. And it's the first step in getting to know how your body works and when you should be timing intercourse in order to get results. Now I've identified here the key things that your chart or your app should be capturing every day or every single month relative to your fertility journey. So you do want to know your basal body temperature. Now I know for a lot of us this is a pain in the butt because you have to remember to do it first thing in the morning before you get out of bed. Once you get into the habit, it can actually become really interesting and maybe something you even look forward to doing. So, this is what I do is that when I hit the sleep button in the morning, I reach over, I grab my thermometer, and I take my temperature, and I do my 5-minute journal in the morning. So I do a gratitude journal. And I just feel like that's a great way to start the day. And so you can also chart your cervical mucus changes, and it's hard to see on this slide, so I'll make sure that you can access this chart if you would like one. Just send me an email. You can print off as many as you want. And the cervical mucus will be slippery and noticeably different, so more wet sensation when you are fertile. You can also chart down when you have intercourse and any hormonal symptoms that help you clue in to when you're ovulating and when your period's coming. And then finally, disruptions. So this is if you traveled or if you maybe had illness. Those factors can actually influence your ovulation as well. So it's important to keep track of them so that you can look back over the past 2 or 3 cycles and notice the pattern. And the pattern is really what we're looking for to help predict future cycles and to keep track of any changes that are happening to keep tabs on your up-to-the-minute fertility status. Okay, number 2, I want you to nourish your bod like it's your job. Preconception, undernutrition, so being low in micronutrients before you conceive, has actually been shown to affect in a negative way the future baby's stress and anxiety responses. This is in both animal and human research, where this kind of state of being low in nutrients, it actually affects the way the hypothalamus, pituitary, and adrenal glands communicate with each other, so that babies end up being more colicky, with more crying. They are more prone to anxiety and depression later on. It's really, really a big deal. Your nourishment has a ton to do with your future baby's health. And it's similar for dads. The preconception health and nutrition informs the health of the DNA because it takes over 100 days to actually produce sperm. And in that time frame, those cells, as they're developing, are extremely sensitive to the environment that they're in, which is the man's body. So micronutrients give us major protection. They protect from our DNA to our fertility to the health of your pregnancy, including preventing preeclampsia and, of course, your baby's future health. And I'm going to talk about a couple micronutrients that are really important to be aware of right now. The first is iron. And iron has immense impact on your baby's brain and central nervous system as they're developing in early pregnancy. And in the second and third trimesters, works together with copper to help produce healthy cognition and neural development for your child. Levels of iron are easily fall in pregnancy for kind of no apparent reason other than you're building a baby. And it's a notoriously hard to absorb mineral, probably the hardest one to absorb. And low iron stores are one of the most commonly missed issues on blood work. So your ferritin, you're really looking for your ferritin pre-conception to be about 50 to 100. And that's where we feel our best in terms of our stamina and our health, but that's also going to be most permissive to fertility and healthy iron levels during your pregnancy. So it's important to get those iron levels up before you conceive, because it's hard to get iron in once you have conceived, especially if you're not feeling well, if you have morning sickness, or if you get constipated from an iron supplement. And always choose an iron that's really absorbable, like an iron bisglycinate or an iron polysaccharide. The ferrous sulfate and, the conventional gluconates and things like that aren't necessarily as easy on your digestive tract, and you want to get the most bang for your buck while not upsetting your tummy. Okay, folate. So you may have been told to take folic acid, and that's fine. You definitely need some forms of folate, but folic acid is a synthetic and supplement form, and folate is the natural form. And a certain percentage of the population, in some literature I've read up to 20%, have a certain genetic difference where they don't process folate or folic acid the same as we would expect. So you're not going to be getting the benefit to your DNA and your fertility from a folic acid supplement. And the way to get around this, you can see here on my list of how to go beyond your basic prenatal. You can take L5-methyl tetrahydrofolate, L5-MTHF. It's that first supplement on the list, and that's the active form of folate. So take the same dose. So if your physician recommended a milligram or 400 micrograms, take that amount of L5-MTHF, and then you bypass any worry about the genetic stuff, because you can take the genetic testing, but it's expensive, and the end result is that you're going to be taking the L5-MTHF anyway. So it's a great option, and it's not present in most prenatal supplements yet, unless you're working with a professional grade product through your naturopathic doctor or your registered holistic nutritionist. Okay, so the second there on the list is the iron. So I mentioned an iron bisglycinate or an iron polysaccharide in a liquid form is probably choice number 1 and number 2 for absorbability. I also recommend that you get enough DHA, which is an omega-3 from fish oil, plenty of vitamin D, so we probably need more than the conventionally recommended 1,000 international units per day for optimal fertility and for programming your baby's immune system toward a healthy balance. Vitamin K2 is also not found in most prenatal supplements, and this is essential to building your baby's skeleton. So vitamin K2 takes calcium from the bloodstream and helps it drive into the bones where it belongs. For vitamin B12, I highly recommend methylcobalamin over cyanocobalamin. Methylcobalamin gives you methyl donors, and let's go back to folate, just like folate gives methyl groups to support healthy DNA, so does methylcobalamin. And those two nutrients, folate and B12, really work together to help you maintain lower levels of homocysteine, which is a toxic amino acid that has been linked to miscarriage. So optimizing your B12 and folate, again, super important for your fertility. And then finally, I've listed here the fertility diet. So I have curated a ton of nutrition research on not only supplements, but also how to eat and what to eat and when to optimize your fertility. And I'll be presenting more about that in a future webinar, so stay tuned for that. Number 3, I want you to love your liver. So your liver just won the honorary sex organ award. And it's not conventionally recognized as a sex organ or a gland, but it does regulate your hormone levels. And it also produces cholesterol for hormone synthesis. So this is a reason why cholesterol is actually good for you. We need cholesterol because we use it to build hormones like estrogen and progesterone and testosterone, and it also is used to build vitamin D. So it's an amazing substance and we do need it. And The liver also will metabolize and break down toxins, including those endocrine disrupting toxins that I talked about when we looked at contamination. And so it breaks them down and gets them going into your bile, which is secreted into your bowel for elimination. Okay, so the liver is really, really important in your fertility. In Chinese medicine, the liver is also the first organ to receive and kind of process our stress levels from our world and decides what to do with it. And when the liver gets too stressed and too congested, it starts to make blockages. And the liver in Chinese medicine is also recognized to control planning of our cycle, our menstrual cycle, breast health, and will even contribute to congestion or cramping in the uterus with your period. So it's really important to smooth out your liver health, smooth that liver energy, and we can start to do that with some foods that support your liver. And I've listed a few of those here for you. We have beets, garlic and onions, eggs, lemon and lime, bitter greens, and then bitter teas like burdock and dandelion. So the liver is stimulated by bitter and sour flavors. And eggs are important for your liver health because they provide a lot of sulfur amino acids and methyl groups again. So that's great for your DNA health. And sulfur is really important for glutathione production, and glutathione is the most important intracellular antioxidant or detoxifier, and it's inside your cells, and sources of sulfur will help you make it. Number 4, and I don't have to say much here because most of you will be fully aware that quitting smoking is the single most important health choice that you can make for your own health, but also your future baby and your fertility if you currently do smoke. Smoking increases the risk of miscarriage, stillbirth, low birth weight, preterm birth, asthma in your child, obesity, and even altered behavior or neurocognitive development in your child. Young women, we have decreased our smoking rates significantly from 35% in the 80s to just 20% today, but it is still way too much. So women can do tons for their fertility by quitting smoking, and also partners. If you're exposed to your partner's secondhand smoke, this is definitely going to be nearly as just as toxic. It just might be a lower dose of that toxicity, but secondhand smoke, you're absorbing it when you're in contact with that person, when you're inhaling their breath, when you're sleeping beside them and they're exhaling and you're breathing in that air. Quitting smoking is a must. Okay, number 5, we're moving through these well. So I would like you to sleep better than a baby. So we've all seen this this kind of situation where baby's kind of peeking through the crib or not really sleeping when they're supposed to be. So babies aren't actually known for having the best sleep ever in most cases. So let's have you sleep even better than a baby. Sleep problems are linked with infertility. When we have poor sleep, we have disrupted hormonal balance. Melatonin alone, that one's really important. That's our deep sleep neurotransmitter or hormone, and it is the conductor of the symphony of all the other hormones. And having good deep sleep with melatonin production, it's really important to help all your other hormones be well. Polycystic ovary syndrome and depressed sexual function or low libido are also linked with poor quality sleep. Okay, number 6, we're almost there. So whittle your waistline means let's get the abdominal weight gain reduced. That's the most threatening to your fertility if you gain weight around your abdomen. Now, this is a really dramatic explanation, but I think it says it all. The impact of obesity on your fertility. So maternal overweight and obesity before conception increase the risk of maternal complications during pregnancy, such as gestational hypertension, gestational diabetes, cesarean birth, macrosomia, as well as birth defects such as neural tube defects, other neurological abnormalities, congenital heart disease, intestinal malformations, and multiple congenital anomalies. Obesity is a really big deal because it disrupts the entire physiological profile of a person. So both men and women need to keep this in mind when trying to conceive. A little bit of weight loss goes a long way. 5 to 7.5% reduction in body weight can actually restore ovulation if you have PCOS and you're overweight. Excess fat cells will make excess hormones. They are a storage site for environmental toxins. And exercise is actually essential to healthy pregnancy and healthy, strong labor. So it's important to get exercising now so that you're used to it when you become pregnant, and it'll just feel that much easier. And number 7, green your clean. So I would love for you to go through your home and review any of these aspects that are kind of scented and chemical stuff and replace them with something more natural. So really the only fragrances that you should be using when you're trying to conceive are essential oils. Don't use synthetic perfumes. You can pitch a ton of them from your house just by going through your kitchen and your laundry room. Air fresheners and scented candles, they've got to go from your home, from your bathroom, from your car. Scented soaps, scented tissues, scented menstrual products, fabric softener, laundry. You can get scent-free for these, and your liver will thank you, because every perfume, every fragrance is actually perceived by your liver as a toxin. It has to be detoxified. When you inhale it, it goes into your bloodstream, goes to your liver, and it has to be processed just like any other toxin. Okay, so cleaners, think about replacing them with something environmentally friendly. Baking soda and vinegar go a long way. And then in your garden, see where you can go organic, pesticide-free with your garden work as well. And the much anticipated 6 purgeable P's to eliminate from your world when you are trying to conceive. Pesticides, phthalates, parabens, petroleum, perfumes, and plastics. Now let me go through a few of these. Pesticides, you can look at the Environmental Working Group's Dirty Dozen, and those are the top 12 pesticide-laden crops. So when they're not organic, they have the highest amount of pesticides in them, and that's one way to cut down on pesticide exposure. Pesticides will also accumulate up the food chain, and they have really significant effects on male and female fertility. So the more organic, the better, and especially animal products, because animals concentrate pesticides by at least 10 times the concentration in plants. And it's the same in our bodies. So as you move up the food chain, humans being essentially a top predator, we will have concentrated several times the pesticides that are actually in the food that we eat. So when you eat animal products, go for organic and free range wherever possible. Phthalates and parabens are both found in cosmetics, and these are penetrants. So they help lotions to not have a greasy feel, and they help with the consistency of products, but they are hormone disruptors. And you'll even find phthalates and parabens in personal lubricant products, and it's so important not to have those exposed to your reproductive system. So there's one brand that I'm looking into right now, and it's called Yes, and it's out of the UK. I have no affiliation at all with them, but it's the only one that I've seen that's a commercial product, permissive to sperm in terms of its pH, but also toxin-free. Petroleum byproducts find their way into personal care products as well, and that's anything by the name of mineral oil, Vaseline, petroleum jelly, and petrolatum. And again, we can be using essentially edible oils as moisturizers and lubricants. So look for alternatives to petroleum byproducts wherever possible, because these are just, byproducts of the tar sands industry, and they're toxic and they actually occlude your pores. They're just really not good for us. Perfumes, as I mentioned earlier, are essentially toxins, and they're not regulated. Okay, so a company can put anything at all into a perfume as an ingredient into your product, like parfum or fragrance, it might say on the label, or perfume. And there's completely no regulation, so it could be really toxic and we would never know what is actually in that perfume. They are not innocuous, innocent substances. So see where you can go scent-free as you pursue your optimal fertility. And then finally, number 6, plastics. Plastics contain hormone-disrupting chemicals such as BPA, bisphenol A, and they are persistent in our fat tissue, and they'll actually pass into the breast milk. So the more we can reduce plastic exposure, the less we'll have accumulated in our bodies. So go through your kitchen and see where you can remove plastic stuff and use, porcelain or metals or wood instead of plastics in your kitchen. Avoid plastic water bottles. Never microwave with plastic bowls or dishes, and avoid freezing food in plastic. And that's where the microwaving and the heating and the freezing is where the plastics break down more easily and find those molecules find their way into our food. Now, there's another kind of hidden obstacle that I wanted to bring to your attention. As part of this webinar, you should have received this Fertility Empowerment Program worksheet, and this is the first worksheet in the program that I often use to introduce women and men to the program. And if you didn't receive it, you can use the one here on your screen. So I would like you to reflect on a couple of things. I want you to just write down what is one thing that you're needing right now in your fertility journey? What do you think is stopping you from having what you're needing? And what's one thing you could do to begin to get what you need? Take a moment to reflect on this. And then what we can do, whether today on the webinar or in the future when you have a little bit more time, is to create an affirmation that can help to essentially establish a new neural pathway toward positivity and receptivity around what you're really looking for. So, for example, you might fill in the blanks in this way. You might say, even though I may not have conceived my baby yet, I totally and completely love, honor, and accept myself just as I am. Okay, so even though I may not have conceived our healthy baby yet, I totally and completely love, honor, and accept myself just as I am. Now you can be really creative with this, and you can start to substitute in with those blanks some of the elements from this reflection above. And I'll let you work with that, and then if you want to send me your responses or your draft affirmations, and you want a little bit of tweaking or help with it, or you're not sure how to craft that affirmation, I think it can be so important and so empowering for you to create these affirmations for yourself, because it's training your brain toward a new level, a deeper level of fertility and a deeper level of wellness. So let me know if you need any help at all with this. And again, send me an email. I will answer every question that I receive at my email address, fertilityempowerment@gmail.com. So finally, as we have engaged with this small exercise, this reflection and affirmation, I'm hoping that I'm leaving you feeling more calm, more centered, and more grounded in your fertility journey, and equipped with a lot of tools and tips that you can implement even this week, even today. You can start together with your partner in removing obstacles and paving the way to healthy, optimal fertility. Keep in mind the relaxation response and the benefits of it. When we are able to choose relaxation and practice relaxation, we relieve the cortisol steal. Cortisol steal is something that happens where cortisol is used to help us survive long-term stress, and it impacts on our fertility because when we're constantly making cortisol, we steal the precursor, pregnenolone, and we steal that away from progesterone production because they have the same parent molecule. So making more cortisol means we steal it from progesterone, so we're not getting the optimal fertility, and ultimately estrogen and testosterone production too are compromised. When you relax more, you reduce oxidative damage to your eggs and your sperm. You avoid programming your baby's early nervous system for more reactivity, and it permits you to enjoy the fertility journey and enjoy intimacy again, be spontaneous, feel healthy. I would say relaxation is essential to relationship happiness too. So now that we've come to close to the end of our session today, thank you so much for being here and tuning in and hanging on. I know we covered a lot of ground. I want you to just find yourself here. Has where you land in this scale, has it changed from when we first started? Where do you land here in these stages, emotions, states, or your feeling of fertility empowerment? Where would you identify where you're at? So here we are, and I want to conclude the fertility empowerment theme here and just let you know, as I mentioned, there's an opportunity to have a call with me. And in this call, we'll explore a little bit more what's possible for you in your fertility journey. We will help you break through one issue that you'd like help with. This could be an issue that right now you're really aware of, and it could be one that you're not yet aware of, and I will be able to help you get to that, discover it, dive a little bit deeper, and hopefully let it go. I would love to help you with that. I've had a number of awesome calls with some of you so far, and every single one of you has come up with a brilliant insight, a liberating insight about where you're at in your fertility journey, something that's blocking you, something that you're maybe attributing to yourself that you weren't even aware of before. It's been such an honor and an inspiration to work with you on that. And so I can take a few more calls from this webinar. And if this sounds like something that resonates with you, by all means, send me an email at fertilityempowerment@gmail.com. Let me know your phone number, and I will give you a call to set up a time to go through this essentially miniature coaching session with you. It's completely free and there's no obligation at all. I just want you to get incredible value from the call. And one of two things will happen. You'll take that value, you'll take that insight with you, and you'll go forward and be that much more fertile, that much more prepared for your journey. Or you'll have the opportunity to learn more about the fertility program itself that I'm offering, and whether that's a fit for you, whether you're ready for that at this time. Okay, so send me an email with your phone number, and I will do my best to fit in a few more calls this week. And the email again is listed there for you, fertilityempowerment@gmail.com. And be sure to join me for my next webinar coming up next month. It is called The New Fertility Diet, and we'll be going through a lot more detail on some of the nutritional aspects that I mentioned briefly here today. And I would love to see you on the call. Thank you so much for being here today, and I look forward to touching base with you in the future. Thank you so much. Bye.